Dr. Joseph Amolo Oluoch is commonly referred to as the father of respiratory medicine in Kenya.
Well, after 50 years in the medical practice, he felt the time was right to reflect and write down not just on his own journey, but that of Kenya's medical services.
That's right. Now, Dr. Oluoch asked his fellow colleagues to take up the challenge. The result is his second book.
Well, tonight on Your Story, Dr. Aluoch opens up the pages and tells us the story behind the story of his new book.
And I start with the story during the last doctor strike. I'm staring death in the face. We are dying one by one.
That was a heartfelt cry of a doomed patient at a Kenyan public hospital.
A cancer patient like me was buried today. I'm stuck in this private hospital now with the astronomical bills that I cannot pay. This sad tale of suffering and desperation in Kenyan hospitals have been repeated by many patients during the ongoing doctor strikes in public health institutions in Kenya.
Medical doctors in Kenya are not usually famous for putting pen on paper.
Others write it for money, others just write it for family reasons, to keep up the family fortunes. If you've been very rich, you write a property.
After the launch of his autobiography, In the Footsteps of My Father, Dr. Joseph Amolo Aluoch's colleagues, appreciating his 50 years in the medical practice, encouraged him to document it for posterity. He challenged 37 other distinguished colleagues with notoriously demanding schedules, pioneer doctors and a lawyer to do the same. And the result was his second book, 50 Years of Medical Services, from 1968 to 2018.
Bottom line, it was not easy. In fact, if it was easy, this book would have been 1,000 pages. This is not a textbook of medicine. It's just stories of various participants of what they experienced over the last years and the way the development of medicine has been.
But where does Dr. Oluoch's personal story really begin?
My father, Wilson Aluoch, was a medical assistant to the physician for the governor in the early 40s. Whenever I was asked, what is your future career, I always said I have three choices. First choice, medicine. Second choice, medicine. And third choice, medicine.
Dr. Aluoch joined Makerere University to study medicine in 1963. He joined the medical service on 1st April 1968 with a starting salary of 960 shillings a month, and he was among the highest paid public servants at the time.
All of us had to be posted to the district to get experience. That's probably the most interesting part of my life. I was taken to Meru District Hospital, where I worked for 18 months. And I was a medical officer, and I was in charge of 3 districts: Meru, Isiolo, Marsabit, up to Moyale. To be honest, it would sound paradoxical, but the health services were better organized.
He then did his postgraduate studies in the UK at the same time in respiratory medicine, where he worked as a consultant. When he came back to Kenya in 1974, he was immediately employed and had 3 jobs: consultant of chest medicine at the Kenyatta National Hospital, honorary lecturer at the University of Nairobi, and at the Ministry of Health in charge of communicable diseases. Kenya experienced the first cholera outbreak in the same year. By 1976, smallpox had been completely eradicated.
There has also been the impact of the HIV/AIDS pandemic.
In the 1980s and the 90s, his book chronicles the first case of HIV in Kenya in 1984, but also a great improvement in medication, from when the only available drugs were sulfur drugs and penicillin injections, to when syringes were made of glass and the blunt needles were reusable after sterilization by boiling water on paraffin stoves.
Despite now the increased measures we have with disposable syringes and with the gloves, we still have a lot of infection.
The 90s saw a great improvement in medical equipment, from the days of the first X-ray in Kisumu in 1951 to kidney transplants and the ICU units, he writes.
Death has become a very expensive thing. ICU in particular improves or saves life in a short time. but it prolongs death in a long time. Life possible, but life for what purpose?
Today, the 76-year-old still practices as a chief consultant physician at the Nairobi Hospital. He is the founder of the TB Association, member and past chair of the Kenya Medical Association.
Many things make me happy. Is the first of all the quantity and the quality of medical care. Now we've got more facility, more personnel looking after people. What is upon me is the affordability of this thing. Because for good health care, you need the 3 A's: availability, affordability, and acceptability.
He is often referred by his bosom friends as Ojengo.
Ojengo Kalawe, which means as smart as his dresses. Yes. And I was so smart in the brain.
As Professor P.L.O. Lumumba writes of him in his second book, Forward, and I quote, "He is at peace with his ancestors, his extended family, his nuclear family, which includes his wife, Lady Justice Joyce Aluoch, of 48 years, come September, and his daughters, Sandra, Brenda, and Connie." Professor P.L.O. uses the Nigerian proverb, "A chick that will grow into a cock is seen on the day it hatches," as the title of his short essay to describe Dr. Aluoch, and the words of Dr. Wilson Marambo.
In my long and eventful life, I have seen potentials unfulfilled and promises tragically broken. Through direct experience, I have seen the pain and sometimes futility of it all. But I have also been granted the favor of taking part in the triumph of promise. And such is the case with the life of my brother, Dr. Joseph Amolo Aluoch. If ever a boy of his generation showed hope and potential for the future, he was that boy.
Dorcas Wangera, Citizen TV, your story.